So this April, right now, April 2026, is Cesarean Section Awareness Month. So let's take a few minutes to talk about what that means. Really, what are the most common signs that you need to have an emergency C-section? The first thing is when the baby's heart rate is not doing great. So those of you who know what I'm talking about, when you are in the hospital, they put these belts around your stomach and they have a piece of paper and it makes like these squiggly lines. And if there's a problem with those lines, if they're going up too much or down too far, then that's something that doctors and nurses are trained to recognize, and they need to take prompt action. Because if your baby does have fetal distress or baby distress, that could mean that your baby has a lack of oxygen. That would be an indication to do an emergency C-section. The second reason would be that if you have a big baby and you're trying to push and push and push, but you're not really getting anywhere, and the baby is just very large. So you can imagine that baby's going to have a hard time coming out of a small space. So that's the second reason why a cesarean section may be needed on an emergency basis. And a third reason may be, let's say you have an infection and you would not want your baby to be subjected to that infection. We talked in earlier videos about group B strep infections and things that would be very problematic if your baby came down the birth canal. That would be another reason to do an emergency C-section. And if a C-section wasn't done timely and your baby has brain damage, which I'm really sorry to hear if you call me, I hate hearing those stories. But if that's the case, then there could have been an indication to do a cesarean section. Earlier C-section has been known to prevent permanent brain damage or even not brain damage at all. So if this has happened to you, you can speak to an experienced medical malpractice lawyer like myself. Thanks so much for watching. If you're new to the channel, hit that like and subscribe button. We're up to thousands and thousands. At last count, over 14,000 subscribers and growing every day. I want you to be a part of it. It's free. You can subscribe. And if you want to unsubscribe, no obligation. You can unsubscribe. Totally fine. But I hope you stick around. I think when you do subscribe, you're going to find a lot of value in those videos. At least I hope you do, because I really spend a lot of time to do that, because I want to put out good content for all of you to get great information. Frank Spector, medical malpractice lawyer and birth injury lawyer. See you again next time.